Hi everyone, welcome to our YouTube video. So today, I will be showing to you guys how to report observations relating the drains to the nurse. After a surgical procedure, practitioners to realize that post-operative patients require as much care as they did before surgery. Therefore, they have to be monitored and observed carefully. A drain is used to remove food such as blood from the body after or before surgery. As we all know, before turning to a patient, we have to observe proper hand hygiene by washing hands properly and putting on gloves. Now, I'll be showing a short demonstration on how to observe a patient's drainage. Hi Miss Luna, I am your nursing assistant today, so I'm going to be checking your draining, which is your catheter. Is that be okay with you? Alright, so I'm going to check the side first. Now I'm checking the area of skin where the catheter is being inserted in order to confirm is there is any form of discoloration or any form of food we can see from the outlets. And from what I see, everything is perfectly fine. And so the next thing I'm going to check is the urinary drainage bag. So what I can see is the patient has not urinated in the past 24 hours, and this is a major concern. So I'm going to have to report this to the nurse. The color of the urinary output is something that I'm also supposed to check out, but since the patient has not urinated in the past 24 hours, I will not be able to determine that. So I also have to inform the nurse about this. What I just did was take the pulse of the patient in order to determine that the patient has tachycardia, which is the heart rate of the patient is higher than the normal. And from my observation, I can see that the patient has a heart rate of 120 beats per minute, and this is considered high, so I have to refer this to the nurse. The heart rate has also given me a rough estimate of what the blood pressure might be. This shows that there is a chance that the patient has a high blood pressure, but I also have to confirm that in order to be properly sure. I also need to take the patient's temperature to confirm the patient doesn't have a fever, and in case the patient's body temperature is high than normal, I'm also going to persisting in this. From what I can see, that the temperature of the patient is perfectly normal. Now that I've made the necessary observations, I need to ensure that I document them properly and reports the nurse. So I have checked the patient's temperature, pulse, blood pressure, the urinary output of the patients, the surrounding skin around the drainage, the intactness of the drainage, the color of the drainage, the amount of the drainage. So this information will help the nurse to make conclusions about the state of the patient. As I have seen, the patient has a high heart rate, a high blood pressure, and her temperature is normal, and a low urinary output, and the drainage is perfectly fine. This can help us to make a conclusion to whether the patient has an underlying illness or if there are any complication that arise as a result of the surgery. So drains are portal entries to which pathogen can enter into the body, so we have to take a proper precaution while assisting the patient in order to prevent infection. Thank you for watching.